Hello, my name is Dr. Cathy Naughton. I am a board-certified urologist at Urology of St. Luke's. I received my doctorate of medicine from the State University of New York in Buffalo. I came to St. Louis in 1993 to begin my urology residency at Washington University School of Medicine and completed that residency in 1999. Following that, I did a research fellowship at Washington University studying growth factors for prostate cancer. Following my research fellowship, I went to the Glickman Institute at the Cleveland Clinic Foundation to complete a clinical fellowship in male infertility and microsurgery. During the past 14 years, I have focused on treating urologic conditions that affect quality of life. I perform microsurgical vasectomy reversals and varicocele repairs to treat male infertility. I offer all treatment options for male erectile dysfunction, including a minimally invasive surgery for penile prosthetic insertion. I have one of the largest experiences in Missouri with neuromodulation, which is a treatment for overactive bladder. Because I have a special interest in treating that condition, I also offer other advanced therapies, such as Botox injections and PTNS, which is an acronym for percutaneous tibial nerve stimulation. This is in addition to physical therapy as well as medication treatment. I have specialized training in the UroLift system, which is a non-invasive procedure for treating BPH, or a benign prostatic hypertrophy, which can be performed in the office. One of my missions is to provide continuing education to the community, to my patients, and to healthcare providers, because I feel that it is only through knowledge that the community will know when to seek medical attention, my patients will know how to optimize their care, and other healthcare providers will know when to refer patients for further urologic care. I believe that it's through these seminars that patients have a resource to learn more about the disease process and what treatment options are available. My patients recognize that I'm passionate about what I do and what I believe in. They also recognize that I'm always looking for new information, and I will change my recommendations and opinions based on new data. I see a lot of men who come to me and ask, what causes erectile dysfunction, or ED? And I tell them it's not what causes erectile dysfunction, but it's more what else is associated with erectile dysfunction. In my mind, erectile function is a marker of good health, just like fertility. And if you think about it, if you're sick as a dog, the last thing you're thinking about is, I think I want to have sex. It's sort of the last thing you're thinking about, and that's because your body is smart. If it's too busy trying to save yourself from your other conditions, hypertension, diabetes, heart disease, obesity, depression, anxiety, addressing erectile dysfunction is going to be way low on the list. Overactive bladder is a common condition that affects both men and women. It's a syndrome complex that's described as urgency, frequency, getting up at night, with or without incontinence or urinary leakage. Most patients begin on medications, but the medications have side effects, they can be costly, sometimes they don't work or they stop working. And so I offer advanced therapies that includes Botox injections, PTNS, which is an acronym for percutaneous tibial nerve stimulation, and something called neuromodulation. Neuromodulation is a different way of treating overactive bladder. It treats the nerves that affect the signaling between the pelvic nerves and the brain. I have one of the biggest experiences in Missouri with this treatment, and it can be a very effective treatment for intractable overactive bladder symptoms. Your diet is one of the most powerful things that an individual can do for him or herself, and the great news is you have total control. I believe that all physicians, whether you're in family medicine, cardiology, gastroenterology, urology, our goal is to provide and treat patient conditions. But our other goal should be to prevent disease. And one of the 4 pillars of good health, in my mind, is nutrition. The other 3 being regular exercise, adequate sleep, and stress reduction. But your diet arguably is one of the most important things that impact your health. Because what do we do more every day, multiple times a day, but eat? I am an avid promoter of plant-based whole food nutrition, which I believe is the best lifestyle nutrition for maintaining health and preventing disease. It's that feeling that I've made a positive impact in a patient's life that drives me and makes my day.